Good afternoon, it's Friday, November 27. I'm Giovanni Dennis with the Midday News. A special welcome to you if you're watching online at onespotmedia.com. 3 persons were shot, 2 fatally, in separate incidents in Negril, Westmoreland Wednesday night. The deceased have been identified as 25-year-old call center worker Camille Davidson from Mandeville, Manchester, and 40-year-old Odain Beckford of Darlaston, Westmoreland. Miss Davidson and her boyfriend were ambushed on the Negril Road around 8:30. The man who recounted the incident says he does not know why they were attacked.
When by her house, pick her up. On my way coming in, all the spot somebody behind the library riding in my yard. Same time I spot the person, they break the bike, realize the person shoot out, fire and shot. Seem like him got in stick, right? Same time I did rev off the bike. I decide to say, hit the person with the bike. End up that the person never run in the direction where me turn with the bike and thing. So end up that I have to try escape because I don't know how much shooter was here or what them capable of. Understand? Girl was on the back of the bike, she fell off. So on my way trying to escape, seemed like that was the time that they hit her. Probably me they make her off about, you know? Yeah, to be honest. Because she did weak out, if she did strength, I know she could have run just like me.
In the second incident, 40-year-old Odain Beckford was shot in the head at his house in West End Negril. About 9:20, a resident reportedly noticed Mr. Beckford's front door on fire. Shortly after, Mr. Beckford emerged from the house and was shot. He later died. A woman ran from the house and was also shot. She was taken to hospital for treatment. Member of Parliament for Westmoreland Western, Moreland Wilson, is condemning the killings.
It's quite unfortunate what is happening, but we are looking at what can be done, some long-term strategies that we can put in place. One strategy, for example, we're looking at installing some cameras and how that can be used to somewhat mitigate and use more intelligence-driven policing to curb these incidences.
Still in Negril, thieves are creating a major challenge for rehabilitation work on the Negril Health Centre. The health centre, which is currently under renovation, has been broken into and a number of items stolen from the health facility. A member of the Rotary Club of Negril, Elaine Allen Bradley, told TVJ News that the health facility was being upgraded to the tune of $12 million. This was being done in collaboration with a Canadian association.
They broke into the clinic on Wednesday night and they broke the brand new window. They have stolen the blood pressure machines, the electronic temperature machines. They have stolen the fan, the wall fan. They have also eaten the nurses' food from the fridges. They have also unplugged the fridges with all the vaccines in it. And luckily, maybe the vaccines might be okay. And these are vaccines for the children and for the elderly people.
She has condemned the act and called for greater collaboration with the Negril community.
I'm sure some of them know the people who are breaking into these facilities. We are trying to upgrade Negril and to make sure the people have all the facilities free of cost. And yet you have people that go in there and vandalize. And it's not good enough. And as a community, we need to hold these people and take them to book.
Over in St. Catherine, thieves carried out a daring daylight robbery at the old Harbour PC Bank on Thursday, making off with millions of dollars. The paymaster inside the bank was also robbed. Approximately $4.25 million was stolen from the entities. About 1:45, 4 men brandishing guns entered the building. Customers were ordered to lie on the floor. They were not injured or robbed. After their demands were met, the men escaped. In the meantime, opposition spokesman on national security Fitz Jackson is blasting the government over its handling of the country's crime problem. Mr. Jackson described the government's strategy to fight crime as carelessness. He made the comment during a recent tour in Trial Heights, St. Catherine, following the brutal killing of an elderly woman and her 2 grandchildren. On Sunday, an elderly woman and her 2 grandchildren were brutally killed in Trial Heights, St. Catherine. On Tuesday, just a mile away in an area known as Old Road, another murder. Janice Lester Reed was shot dead at her home. Her mother says Janice was inside the house with her moments before the incident.
Our husband come in the time he be out of the shop, but we no know say a man have him juke down on the gun. And him come in and him said to his wife, as they call her Johnny, and him stay out of the grill, and him said, Johnny, come here now. Because I'm under pressure with the gun and him back draw up. And he said, Johnny, come here now. And she get up, we go to him now. So me get up, go through the stuff, we go in the kitchen. But when me get up and as she step down, so me see a shine gun, pam, pam, pam. So me kind of took off. You understand? Me see when the gun, and me just and just took off.
Then, on Wednesday morning, the body of a man was found on the Old Iron Bridge in Thompson Pen, again in Spanish Town. It's believed the man known as Walker was stabbed to death. All three incidents happened in one police division, and the opposition spokesman on national security, Fitz Jackson, is blaming the government. Mr. Jackson says the recent spate of killings is evidence that criminals are fearless.
The country is under siege. It has been under siege for some time, and the government continue to fail to get a grip on the situation.
He argues that since the general election, there has been greater carelessness on the part of the government.
Now, why do I say so? Where's the press conference by the government, the Prime Minister, the Minister of National Security on these issues? They have gone virtually silent while Jamaicans are being killed, being slaughtered mercilessly by criminals.
Violence and crime is out of control in the country and has been for some time. The government doesn't really seem to have a strategy for dealing with it, and we call upon them again to really diligently think about how we can address these issues and make the people safer in their homes.
Minister, when he was campaigning to be the chief servant, he said we were going to be able to go to our bed and leave our doors open. The 82-year-old and the 12-year-old and the 10-year-old were murdered inside their houses. The other lady down by Old Road, she was murdered in her house. Prime Minister, you need to do something about this.
So far, the family's been comforted. Today we had the Restorative Justice Unit here along with the police, community safety police, who spoke to residents within the community. They had a rap session with them, and I believe that persons are now coming to terms with what has happened. They've been able to express themselves how they are feeling as a community. Today, the community is still saddened, broken, and shocked, but they are picking up the pieces slowly. And
the team was touring the community Thursday, offering sympathy and support to the grieving families. The country's health sector could be faced with immense pressure with a triple health crisis and the rate of murders in the country. Health Minister Dr. Christopher Tufton painted the grim picture in an interview with members of the media on Thursday in St. James. Prince Moore has the details.
Earlier this month, there were strict warnings from the Health Ministry for citizens to take better care of their health and their surroundings, as there could be a triple threat health issue. This includes dengue, flu, and COVID-19. National epidemiologist Dr. Karen Webster Carr pointed out that if citizens do not take preventative measures, it could cause a serious burden on the country's health system. But another challenge is the burden of the large number of murders across the country. Data from the Jamaica Constabulary Force shows that between January 1 and September 21, some 1,161 murders have been reported in Jamaica. Despite this being less than the corresponding period last year, it's a cause for worry for the Health Minister.
Well, every Jamaican should be concerned about crime and criminality in our society and should condemn crime and criminality. It certainly makes the job of public health more difficult because cases of trauma, whether gunshot wounds, stab wounds, blunt instrument wounds or otherwise, does require hospital time, surgery time, accident and emergency time. So we certainly join in expressing our concern and condemnation to any acts of crime or violence.
It's why he says that the crime situation needs an all-hands-on-deck approach. Dr. Tufton says the government can do so much and no more.
And during this season more so, we need to reject any act of violence, just as we act to reject the possibility of the spread of COVID-19.
Prince Moore, TVJ News.
2 more persons have died from COVID-19 locally, increasing Jamaica's death toll to 250. The latest deaths are a 74-year-old man from St. Catherine and a 62-year-old woman from Trelawney. The Ministry of Health says another 2 deaths are being investigated. Meanwhile, Jamaica's COVID-19 case count has increased to 10,600. 59 new cases were confirmed on Thursday. Further afield, Germany surpassed 1 million coronavirus cases on Friday. The Robert Koch Institute says the country has reported more than 22,000 new COVID-19 infections in the past 24 hours. There were 426 new deaths related to the virus. That was the highest single-day death toll since the beginning of the pandemic. On Thursday, German Chancellor Angela Merkel said coronavirus restrictions and the partial national lockdown will last until December 20 and could be extended into the new year. And despite some lack of clarity surrounding its data, the AstraZeneca Oxford vaccine is currently being assessed by the UK's medicines regulator. It marks a significant first step in getting the vaccine approved for deployment across the UK. If authorized, it makes the UK one of the first countries in the world to receive a vaccine. AstraZeneca expects to have up to 4 million doses ready for the UK by the end of the year and 40 million by March 2021. AstraZeneca said the vaccine had shown an average effectiveness of 70% in large-scale trials. And it's now time for a break here on the Midday News. Please stay with us. We'll have more news when we return. Welcome back, and we're continuing the news. Stakeholders in Clarendon are already expressing fear that the parish's resources could be stretched thin if the projected COVID-19 spike comes after Christmas. Authorities in the Central Parish staged a sensitization campaign in Maypen that they hope will help cauterize January's expected fallout. More in this report.
Taxi and bus operators in Clarendon were targeted by public health authorities on Thursday as part of a special COVID-19 operation. Taxi and bus operators are likely to interact with more persons on a regular day than the normal citizen. Many of the operators are also not obeying COVID-19 guidelines.
Our key messages will be the importance of hand washing, the importance of wearing a mask and keeping it on, and insisting that the persons in the taxi have on masks. We're going to be also reminding them that they have to carry 1 passenger less as well, and they must sanitize the taxi between trips.
The taxi operators were also given free sanitizers and masks. Bumper stickers warning passengers they will not be allowed aboard if they do not have on masks were also distributed. Custos of the parish, William Shaguri, who participated in the exercise, expressed fear about what Clarendon and the country by extension will be like after Christmas.
The health department is under stress now, as we know, and if it spreads even further, the government will have to probably take more drastic action in regards to what is happening. And with the amount of persons coming back into Jamaica, I am very worried that after Christmas this thing is going to even spread more. So we need to start trying to contain it even before to keep it from spreading.
Thursday's COVID-19 mission also gave the health team an opportunity to address other medical matters that may impact taxi and bus operators.
HIV, STI, so we're going to be talking to them about reproductive health, sexual health. We're going to be giving them condoms. We're going to be doing HIV, STI testing. We're going to be talking to them also about other topical issues, dengue fever. That is, there's a threat because of the rains. We're going to be talking to them about the flu because the flu is also in circulation.
O'Shane Masters, TVJ News.
The Jamaica Hotel and Tourist Association is employing several strategies in a bid to increase tourist arrivals. The latest initiative is the COVID-19 Ambassadors Program, which seeks to have persons adhering to the protocols put out by the Health Ministry. Herman Green reports.
The country's tourism players are on a drive to improve service delivery as the COVID-19 pandemic continues to have a negative impact on the sector. But with the tourism ministry expecting over 100,000 visitors for the winter tourist season, the players in the sector are not leaving anything to chance. It's why this week, the Kingston and Montego Bay chapters of the Jamaica Hotel and Tourist Association, JHTA, launched their COVID-19 Ambassadors Program.
There was definitely a gap right there because employees would come in and we would follow what we call the 4 pillars, as basic as that. Wash your hands, sanitize, physical distancing, not social distancing, physical distancing, and wear your mask. Those are the pillars on which this program is built and will continue to work.
The program comes on the heels of Thursday evening's disclosure from the Health Ministry that there have been COVID-19 cases in the tourist industry. Technical Director at the Western Regional Health Authority, Dr. Diane Campbell-Stennett, said the authorities do not know if the cases are linked to tourists.
The last thing I want is for us to be blamed for any outbreak or any spread of the virus.
General Manager of Sandals Grand Ocho Rios, Brian Roper, says the initiative is a positive move as it will aid in getting visitors back to the island.
The future of this industry, and in fact, the future of Jamaica's economy, more or less is dependent on what we do now. If we don't do these things now, believe me, 3 years, 5 years, probably 10 years down the road, we're going to be feeling the repercussions of that.
In the meantime, the JHTA president is calling for the retraining of tourism workers.
The level of transmission within hotels and other businesses who observe the protocols, they are very, very low. And we want to keep it that way. So this is another reason I'm challenging TPDCO, JTB as a partner, and Ministry of Health in particular, that they must now come in, resensitize, retrain our employees as if it was day one.
Herman Green, TVJ News.
The Negril Chamber of Commerce says it hopes to do more to assist tourism workers who have lost their jobs. President of the Chamber, Richard Wallace, says this would be in addition to some 1,000 care packages the Chamber has already distributed to these workers.
Programs like that cost a lot of money, and money is very short and right now. However, we're negotiating with some of our partners and trying to see if we can put it together to do another food package for the community, because we know now more than ever is when they need it.
Meanwhile, Health Minister Dr. Christopher Tufton says no timeline can be given for the completion of works on the Cornwall Regional and the Western Children and Adolescent Hospitals.
No date right now. COVID has really created some challenges for many of our capital projects, including Cornwall and the Children's Hospital, because it has slowed down some activities. We have to recalibrate that and look at what is happening.
The Cornwall Regional Hospital was closed in 2017 due to poor air quality after a number of health professionals at the facility became ill. In the meantime, additional funding has been provided for work on the Type A facility in Western Jamaica. Information Minister Favour Williams provided the update at the post-cabinet press briefing on Wednesday.
Cabinet gave approval for the variation of contract in the amount of $111.8 million to M&M Jamaica Limited for the rehabilitation program for emergency works of the 10th floor and roof repairs at the Cornwall Regional Hospital in St. James. The adjusted contract amount is now $208.1 million approximately.
In sports, the Reggae Boys have risen one place to 47th in the November edition of the FIFA World Rankings. The rise comes after Jamaica's recent 2-1 win over Saudi Arabia on November 17. Despite suffering a defeat to the same opponent 3 days earlier, Jamaica's rise comes after Scotland and Ghana slipped after losses in the Nations League and Africa Cup of Nations qualifiers. Jamaica remains third in CONCACAF as Mexico continues to lead the region at 9th in the world, while the United States are second at 22nd. Costa Rica, Honduras and El Salvador round out the top 6 in the region. Jamaica also remains number 1 in the Caribbean, with Curacao second at 76th and Haiti third at 84th. The top 10 ranked teams in the world reads Belgium, France, Brazil, England, Portugal, Spain, Argentina, Uruguay, Mexico and Italy. 4-time World Cup winners Germany are 13th. And that's the Midday News. I'm Giovanni Dennis. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, good afternoon.